Hey guys, Dr. Cody here back with another explainer series. I hope you guys enjoyed the one we did last week on cervicogenic headaches. And today we're going to do the most common condition that we see here in the clinic, and that's low back pain. Yes, low back pain is the number one condition that patients see chiropractors for, and we do a really good job of treating that. But there's a whole host of things that can actually cause low back pain. So just kind of going over the most common ones that we see in the clinic here. So first one we're going to go over is sciatica. Now, sciatica is a very specific condition that is irritation to the sciatic nerve. So the sciatic nerve is made from branches of the L4, L5, S1, S2, and S3 nerve roots. They blend together and form the sciatic nerve, which is about this thick. It's the thickest nerve in the body. That nerve runs all the way down the back of the leg into your foot. So when you have true sciatica, it's going to be compression of this nerve resulting in pain, sometimes in the low back, but mostly in the leg itself all the way down into the foot. There's a couple areas where this can get compressed, but the most common one that we see is going to be this guy right here. This is the piriformis muscle. It's a muscle that runs from your sacrum out to your hip, and its main job is hip stabilization, and it aids in abduction and external rotation. So a lot of times what I find that this muscle is weak on a lot of people, and we're asked it to do too much, so it winds up getting irritated, spastic, and it can actually pinch down on that sciatic nerve. Next, we're going to go over disc pain. So discs, whether that's bulges, herniations, sequestrations, anything like that, anytime there's material that's pushing out of this area here. And so if we look at this diagram, this is looking at a top-down view of a vertebra. So we have our little model here kind of demonstrating the same thing. The disc is made of two parts. This outer ring is called the annulus fibrosus. It's more of a connective tissue. And then the inside is the nucleus pulposus. That's more the jelly-like material. So with this vertebra here, we would have the vertebral body on top, the vertebral body on bottom, and the disc in the middle. And obviously the disc's main function is spring, right? It's cushion. It helps absorb as a shock absorber. Where we see here is we have this little yellow circle here. This would be your spinal cord, or if we're below the L2 mark, right, it's something called the cauda equina. Yeah, your spinal cord terminates around the L1, L2 spot, and then you just have this collection of nerves that kind of exit through there that go down to control the rest of your body lower. Coming out the sides here, we have our nerve roots, and this is where the compression can actually take place. So if we see here, we have a little herniation that's pushing out on the right. It's compressing this nerve root as it exits this space, which is the intervertebral foramen. So that's this hole right through here. So we have our spinal cord running down the column, and then through this hole we have our nerve root. Now these nerve roots exit everywhere, like all along from the top of your neck all the way down into your pelvis, and they're what's actually sending signals and controlling every function your body is doing. Okay? And if this disc gets out too much, it can actually push and compress this. This would create pain that we would call radiculopathy, right? So that's pain, weakness, tingling, any kind of sensory issue running down following the path of that nerve. So this kind of pain is very specific. Usually patients will be able to describe it in like a finger-like manner. So be like, oh, doc, I have pain, here in my low back, and it goes all the way down like this. And they trace it with the finger because it's following this nerve path all the way down. And this is different than the next one we're going to talk about, which is going to be facets. So with facets, the facets are actually the joints within our spine where movement actually occurs. Okay, and so they're right here on the side. And these joints are very prone, especially in the low back, to pain because of where they're located. They're on the back side of our vertebral column here. And so with our low back, we tend to find that we get weak muscles along the low back here. And we get weakness in our core, and so we tend to like slouch back like this, right? And as we slouch back, we compress these facet joints, and we compress them, they can elicit a little bit more of a pain response. And they're more prone to pain because of where pain receptors like to be found. So there's a lot of pain receptors in the outer layer of bone called the periosteum, and since these joints are planar, which means they're flat, there's a lot of surface area, and so there's a lot more space for it to become irritated and inflamed. These can also get irritated in injuries, so we can actually sprain these joints as well, which can also result in some pain. And during degeneration, right, we talk about like degenerative joint disease, these joints can actually hypertrophy or grow, and they have a very close proximity to this IVF as well. They actually make up the back portion of it, and so they can also compress and irritate that nerve root. Now, their pain referral patterns can be a little different, right? So we talk about the disc having more of radicular type pain. With facets, it's more something we call sclerotogenous-like pain. And that's going to be more broad-based pain. So when patients come in, they say, oh, I've got this achy, deep pain in my low back, and it travels like this, right? They use their hand to describe it. Typically, this pain is going to stay into the low back, the upper glute, or even to like the top of the hamstring, and it rarely goes past the knee. Or the disc, if we're talking the L4, L5, or lower nerve roots, it's going to go all the way down that nerve pattern. So we have our facet pain. And last, we have muscle pain, right? So muscles can get irritated from a lot of different things, whether we're straining them, whether they're over weakened, whether we just have excessive tugging and pulling on these joints. We talk about how the outer layer bone, that periosteum, has a lot of pain fibers. Tendons connect muscle to bone, and the tendons, when they connect into the bone, they actually blend into that outer layer of periosteum. So here's a few muscles that we typically find a little irritated that can create some of this back pain. So the QL muscle here, we have our iliocostalis, longissimus, and our spinalis. And so these are other areas that can create that low back pain. So, but I hope this answers some questions about like what may be causing my back pain. Now, obviously, there's a bunch of other things that can cause the low back pain, right? So vitamin deficiencies, we can get metabolic disorders, but here in our clinic, this is definitely the most common sources of low back pain that we see. So I hope this answers some questions for you guys. And if you would, drop a comment below. What do you think the most common source of low back pain that we see here in the clinic is? And be sure to follow our next video where we explain how we would treat these in the clinic. Each one has a little bit of a different style of treatment and some things you can do at home to treat and also prevent low back pain from coming. So hope you guys are having a great day. Look forward to seeing you in the clinic.